My name is Michael Rubino.
I'm on a personal mission to make sure you don't get sick inside your own home.
I knew there was something wrong. I'm just so relieved there's something that you can do about it.
Hello, everyone, and thank you for watching another episode of Never Been Sicker. I am your host, Michael Rubino. And today's amazing special guest is Dr. Jen. Dr. Jen, how are you? Thank you for taking the time out of your busy day to be here with us.
Hi, thank you so much, Michael. Excited to be here.
All right, so we're going to talk about a topic we don't talk about all that often, but I'd like to discuss perimenopause with you, if that's okay with you.
Yes, I would love that.
All right, so first off, we'll just high level, how did you get interested in integrative medicine?
Right. So I graduated from my emergency medicine residency and went to work in a community ER. It was still a level 2 trauma center, but I was working there full time, just out of residency, ready to make a difference, heal the world. That's why I got into medicine, wanted to treat the body as a whole. That's why I'm a DO. And I just was very upset. I was very upset that most of the things that I was treating in the emergency room were chronic illnesses that could have been prevented. And I remember this one patient would come in with abdominal pain, belly pain all the time. And she had like 5 CT scans the year before. And for those of you that don't know, that are listening, CT scans is a lot of radiation, especially to the abdomen. And radiation can cause our cells to turn into cancer cells and kind of like go off track, kind of like a train that was derailed. So I remember talking with her. I'm like, are you following up with your doctor? And she's like, yes, I go to my primary care doctor. So I started having her, this was me working in the emergency room. So I had her start keeping a food diary and talking to her about like, what are you eating? Do you think it correlates to your belly pain and all of that? And I remember coming home and I told my husband, I'm like, yeah, I need to go back and do an integrative medicine fellowship. And he's like, really? Here we are, with lots of medical school loans and, I have to pay to do a fellowship and that's more time. Yeah. And he was so supportive. He saw the passion in me. Also along that same line, I had my first son. So it had really flipped, from, when it's just you taking care of yourself versus when you're pregnant or breastfeeding and things that you're eating are going to someone else. So it's not just about you and your body. And I know as parents, we think about this a lot because our environment, our house, our food we put on the table, it's not just us. It's not like we're living the single life anymore. So, so he was very supportive and I went back and did an integrative medicine fellowship. And that's been about a decade of me practicing integrative medicine. And I still work in the ER and not as much though, as I have a busy practice, but I love working in the ER still because it keeps me very grounded and passionate about the disconnect between, insurance systems, big hospitals and real actual foundational health and prevention. So it makes me very passionate about that. And I love teaching and talking about it to anyone that will listen.
Well, thank you for recognizing that gap and, jumping into the integrative space. I know it probably wasn't easy to go through all the additional, the fellowship and probably a lot of the sacrifice you've had to give, but really awesome that your husband was so supportive. And I think that's really great because, unfortunately, a lot of people, they are dealing with chronic illness and a lot of times they get neglected by the medical system, mainly because, if they go to a doctor and a doctor doesn't know, right? They don't know, and so they can only do what they can do. But it happens.
And it's really wild that a lot of the pushback I've gotten have been from other doctors. And my patients will, go with what we're doing, which isn't always, this is what the Clinical Society of Endocrinologists suggests or something like that. Cause they still think you can't reverse Hashimoto's disease, for example.
Isn't that interesting?
Yeah. Which I've reversed my Hashimoto's disease. My antibodies are 0. And
nice.
They give the most pushback. They're like, well, you're seeing this like wackadoodle. And I'm like, excuse me, I'm double board certified. Like I actually have more school than you. And I tell my patients, I'm like, give them my cell phone and I would love to talk to them, because that's what like doctors used to do. We all used to talk to each other and get through tough cases and learn from each other, not learn from what the hospital protocol tells us to do. And I really think that protocols are important for emergency medicine and for specific things, so people don't fall through the crack. But what is making everyone sicker in the United States, where we spend the most on healthcare and we're still the sickest, is that doctors can't, they just follow the protocols. Like they can't even see around the protocols to look at the patient and see what's different with their story. They can't even find their own patterns or anything. It's wild. And, I don't know. I think the hospitals are a scary place to be right now, because people tell me stories like they don't know my background because we just moved to Tennessee, and I'll just be listening to these stories and I'm like, oh, like what's going on?
The medical community is a lot like my community in the indoor environmental space. It's really funny. It's like, we're quick to call each other quacks, as opposed to, really understanding that there might be new information or different case studies that people are operating off of. Instead of like sharing with one another, and, we tend to tear each other down instead of building each other up. And so I see that with doctors too. It's like, no, my protocol is the best protocol. Everyone else is a quack. That's why, and it's interesting because obviously, look, we're all different, right? Some things might work different for certain folks, and some people might be really, really sensitive and might need a different approach, right? And I always found it interesting how we, are so quick to tear each other down instead of build each other up. And I think that's been that lack of unity has really actually caused the patient population to suffer the most.
Yeah. And, like, not to get too deep into this, but what is the root of that? Like, what is the root emotion? Is pride, right?
Yeah.
So if we're letting our pride get in the way of patient care, client care, whatever, that's a bad root to have. So listening, not talking and listening more and letting go of that pride so we can really help people out. I think that is something, while I've aged and grown in maturity and, wisdom, that I can really try to, if I see that coming up with me, I try to shut it down.
Yeah, no, it's really smart to do that. I mean, it's sad, but it's a true reality. For those listening who are like, man, this is rough. It is. Sometimes even you have like the medical profession, you have the science profession. Unfortunately, people cherry pick stuff, and they like you said, that there's this specific pride that they have in what they know, and the ability to learn new information. Sometimes can really be lackluster, and that's where it can affect the patient population. So if you're listening to this and it resonates with you, just know you're not alone. You're not crazy. It's taking a long time for everybody in these industries to get on the same page, unfortunately. And so you have to know who aligns with your ideology.
Yeah, absolutely.
So let's get back on track to perimenopause. I know we got off track a little bit, but what happens to hormones during perimenopause?
Yes, so perimenopause is such an important topic for men and women, because men, you're going to see some changes in your wife and your friends and your family members, and women, you're going through it. And what I have seen a lot in my office, in my integrative office, is that this is a patient population that is struggling, and they are going to their doctor and not really getting help. They're kind of just treating the symptoms and not the root cause. So perimenopause is before menopause. So menopause is the definition when women don't have a menstrual cycle for a year, and their estradiol, they are not making any more. And then their progesterone is low too. So what happens for women, we have these two main hormones, progesterone and estradiol, that play and that are higher at different points of the menstrual cycle. So the first 2 weeks of the menstrual cycle, the follicular cycle, estradiol is on the rise, and that is higher. That's the predominant hormone during that phase. Then you have ovulation, and this is when testosterone peaks in women, and then progesterone starts to rise after that for the luteal phase and is the predominant hormone for the luteal phase. So this goes on every 28 days. Women have different hormone levels on every single one of the 28 days, right? Where men, it's 24 hours. So that's why, you can see, like, Michael, you're the same every day, right? It's the 24-hour hormone. Where women, we're special. We're different on different days of the cycle. It's a big joke with my husband. I'm like, yeah, I'm going to be more emotional. I'm late luteal phase. And he's just like, you can't blame it all on your hormones. And I'm like, no, it's like true, right? Like our hormones are different. So getting to know these and getting, used to recognizing where you're at and how it might affect, your workout, your mood, and, what you should be eating, all of these things. So
well, I love that you can like master that, right? Like for me, I'm going to be honest. It's pretty easy for me. I've got consistency every 24 hours. I know what I'm going to get, right? Yeah. But you have a lot to navigate as a woman, but at least if you know how to navigate it, right, then you're in control of it, which I think is really cool and really powerful. I mean, I've just been watching my wife, get more into her cycle and tracking her apps and, become more in control of it because, she would go through these swings and stuff and not really know what was going on. And, obviously she's a woman. She understands that, her body goes through changes, but you'd be surprised that not everybody really understands and tracks these and masters it, right?
Yeah. And I like to think of it as it's our superpower a little bit. So we can really just pay attention and be more in feel with our hormones in our body. And this is really important even pre-perimenopause, right? So in your 20s or 30s to recognize this. And I talk to my daughter a lot about it, like where are you at in your cycle? And it's funny, we moved recently, which was like a lot of stress, and my cycle got a little off. And now, we've been here about 3 months in Tennessee and our cycles are back together already. Cause I'm like, where are you at? She's like, I think I just ovulate. I'm like, me too. So it's kind of fun because ladies are known to do that. So anyway, with your cycle, you want to, and we could talk about cycle syncing later. So you really want to be aware of that. Now, what happens is during perimenopause, your progesterone is just going down, 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 down. Okay. It's not, it's not like a drop off. It's just a consistent going down. So what could this look like? What could a lower progesterone look like? Well, it looks like estrogen dominance, which we hear that termed a lot. So this is when estrogen is out of balance to progesterone. So this could be really bad PMS symptoms such as cramping, bloating, back pain, being very agitated, irritable, and very heavy cycles. So it can look like that, plus also a shortening of that luteal phase. So when you used to have 28-day cycles every month on the dot, now they're 24 or 26. And that's from that progesterone coming down. Now, what happens with the estradiol during perimenopause is it's pretty erratic. So it follows the normal kind of higher in the luteal phase, but then it could be a little bit more erratic as the eggs or follicles aren't as robust, right? Because we're born with all our eggs. So after time, those don't get as high of quality, right? We have higher quality eggs, in our teens and 20s and 30s, and then our 40s and 50s until they're gone. They're the end. It's the end. They're aged. So sometimes we can get, the extra surge of estradiol because we have an extra surge of FSH or follicle stimulating hormone. So we see more erratic estradiol. So that could even make this, balance of estrogen and progesterone even worse. So then our symptoms are even worse. So it's very frustrating because women will start to notice both of these symptoms, especially the progesterone decline. And they're, one symptom that happens a lot to women is they just get anxiety out of nowhere. And they're like, I am not an anxious person. Where is this coming from? Another complaint is weight gain. They haven't changed anything. Like they're like, I eat the same thing every day. I work out the same. And all of a sudden they're gaining weight around their abdomen. And also, cortisol can come into play here. A lot of the times it coincides with women in perimenopause. They have kids and they're running them around all these practices. They have aging parents. It's just kind of everything is coming to a head. It's very difficult for these women. So it's really helpful to recognize what is normal and abnormal. Basically, any PMS symptom is abnormal. If you're having a really horrible time with your cycle and you have to stay home from work or school or whatever, that is a warning sign that the balance is off. And sometimes this can happen because our estradiol is just higher and we can't detox it well. And what are things? This is a good question for you, Michael. What is one toxin that takes up a lot of time in our liver and can really prevent, estradiol from being broken down correctly?
Is it mycotoxins?
Yes, it is. Very good.
Right.
Yeah. Yeah. So see how this kind of ties back, right? And I have had patients that live in moldy buildings or a moldy home and they don't know, or a moldy work, and it is affecting their hormones. So they're looking more estrogen dominant. It's also putting stress on their body. And if we have a lot of cortisol or stress, that can kind of rob our progesterone a little bit. So you keep having more and more of an imbalance. And pair that with all the environmental toxins that are estrogen mimickers and xenoestrogens, meaning they act like an estrogen on the receptor. I mean, it's a recipe for disaster. So a lot of these women in perimenopause, it's really, really noticeable, and they can't, tough through it anymore. It's not like they can just take a Motrin, which I wouldn't recommend taking a Motrin. I like cramp bark, but they're taking things to just help get through. So it finally gets to this point and they go to see their doctor, and their doctor, puts them on an antidepressant or something. So, I mean, I'm sure you've heard this story before, right?
Yeah, definitely. I mean, even my wife has had like debilitating migraines during certain times in her cycle, and it's tough to watch, somebody go through that type of pain. And it's, try to pick up the pieces wherever I can, and be supportive as best as I can. Curious about that is, like, when someone's going through this, how can their partner best support them? What are some advice to the husbands out there that are looking for, to just help? I feel helpless sometimes, in those situations.
Yeah. Well, I always tell my patients, I love symptoms because God gave us warning signs for disease, right? It's not like, bam, all of a sudden we're just sick, right? We have warning signs, and a lot of them, really PMS, I think, was just, it shouldn't even be a thing. It should be like, okay, this is not PMS. This is estrogen, dominance. This is an inability to detoxify estrogen. This is a progesterone deficiency, but symptoms sell things. They sell Midol and heating pads and sick days off work. And it's a reason for doctors to put you on birth control, which is the worst thing you could do if someone is having hormone problems, because it masks everything, right? And we know that birth control comes with risks of infertility and, cancer, way decades down the line. Yeah. And, it happened to me. I had an irregular period cycle and they put me on birth control. Now, people should not be on birth control unless they're using it as birth control and there's no other ways, and they have to be on birth control to prevent pregnancy, and I've had maybe one patient that was like, I need to stay on it, otherwise I'm too stressed out, at the chance of a pregnancy. And I'm like, okay. Right. Every other woman patient we've successfully been able to wean them off of them, which is just stopping them, but get them off and get them to the point where they're not having PMS or headaches. And they're doing this without the birth control, but they have this fear that if I get off the birth control, I'm going to be back to feeling miserable. No. So what you can do is, make sure you have proper cofactors for methylation and detoxification. So that would be a good methylated B vitamin and magnesium. Magnesium is great. It's very important for methylation detoxification. Something like NAC or glutathione to help with detoxifications of estrogens and estrogen breakdown products. Broccoli sprouts, DIM or I3C DIM, those are supplements also that help with that. Now, that's more estrogen detox. So you can look at that phase where you're getting estrogen detoxified, which is through the liver, and then also through the gut health. So the liver is so important because if it's clogged up with a bunch of environmental gunk like mycotoxins or VOCs in your home, or if you eat out of plastic every day, microplastics, BPA, all of that, it's clogged up. That's going to affect how the estrogen goes through. So you can think of like a clogged sink, or shower with hair,
Right.
we have hair. So it's clogged. Nothing's getting through because of that toxic buildup. So and then what's the side effect of that? You have a shower that's overrunning and leaking, and then you're getting mold, right? So we need to make sure we focus on the liver, but then we also have estrogen go through the gut health, and we need to make sure that our gut health is working properly and getting that estrogen all the way out. Another herb that's really great is chaste tree berry. Chaste tree berry is great to help our body make its own progesterone and give that a boost. So a lot of the times, depending on when a woman comes to me, at what age they're at, if they're still at a spot where I think, 3 months of chaste tree berry could help, because that's usually when we check the labs after 3 months,
Right.
and that really boosts that progesterone during luteal phase, then we'll stay with that until they get to the point, like usually after 40, it depends on the woman. And then we're just like, okay, we're going to do luteal phase progesterone. So we just support with bioidentical progesterone in that second half of that cycle, that luteal phase. And then that really helps women get through that perimenopause transition. So those are some things that can really help. And honestly, I've had patients in high school or college that we tried chaste tree berry and it didn't really do much. And we put them on some luteal phase progesterone because I would rather do that than have them be on birth control. Right.
Right.
So it's pretty patient dependent, but there are so many things that you can do to support that. And here's the thing, you could try supplements too. And if they don't work, well, maybe there's another like environmental toxin like mold we spoke about. Maybe there's, really bad gut health problems, like small intestinal bacterial overgrowth, or there's something else that's just causing so much stress and inflammation on the body. So it definitely is a whole body approach when it comes to women hormones, but hormones are a big piece of the puzzle if you're not feeling well.
Yeah, as you were talking, like literally just remembered this conversation with my wife. She's going to kill me, by the way, because I brought her up like 3 times already on this one. But, but she went to the doctor. She wasn't feeling well. She like for sure felt she had hormone imbalances, right? And she comes back home later that day and she's like, hey, they want to put me on birth control. And I was like, birth control? Like, what does that have anything to do with your hormones? I was like, did they recommend like a hormone panel to like test your hormones? No. I'm like, wait, so you go in and you're like, hey, I think I have hormone imbalances. Can you check my hormones? And they're like, just get on birth control. That'll regulate your hormones.
Right.
I found that whole thing bizarre. So it sounds like you agreed that it is a kind of a bizarre approach.
Very bizarre. And that's every day. That it's either that or an antidepressant. I'm surprised they probably recommended that too.
That's the next visit, I'm sure.
Right. Well, let's do an antidepressant.
Jeez.
Yeah, it's okay, so it might be all they know and they think they're being helpful.
Right.
I mean, you do get brainwashed in medical school, and unfortunately our boards that we have to, or these like COMLEX tests that we have to pass in medical school, there's 3 steps. They're very stressful. Like it's all basically match a disease with a medication.
Wow.
Okay. Yeah, it is. It's a lot of that. So we're almost like trained to think, and this, you could go back on who owns medical schools and all that stuff, but it's a lot of like grooming and brainwashing that I had to unlearn a lot from that and be like, okay, it's not a medication that's the answer. There's a root cause. And another thing is a lot of doctors, they go through their residency and they're done, right? They're just done learning. It's just a messed up system, honestly, because we come out of medical school with really big amounts of school loans. So we feel like we have to like just work to pay them off and to have a living. And most of us put off having families until we got through residency. So it's like this vicious cycle. So I try not to like yes, I'm frustrated with doctors, but it's also like the system and they don't know better.
Yeah, system's broken.
Yeah, it's very, very broken. So that's why it's awesome. I think the tides are changing a little bit because more and more I have patients go to doctors and they're okay that I see them, and they're like, oh, that's interesting. And they don't like shut them down or be like, that's dumb.
That's great.
Yeah, it is good because I think the word's getting out there with podcasts like this that, birth control is not good.
Right.
And that should not be the answer. But it is really odd because I feel like I still hear that a lot, that doctors, primary care, even still some OB-GYNs, they just refuse to check labs on hormones. And they say that it doesn't matter. It's so weird.
It's bizarre.
Yeah. So in that case, you could see a functional or integrative doctor, or right now you can just like order labs yourself off the internet, Yeah. I mean, and that's what I try to tell colleagues that are very conventional and, friends that I work with different boards I'm on and stuff. And I try to tell them, look, like if we're not changing with the times, like collectively as DOs, our patients are just going to go somewhere else. Like, don't we want to be at like the forefront of knowing these things that our very smart patients are learning, whether it's a podcast or ChatGPT or, don't we want to like team up with them? Yeah, it's coming. It's still pretty resistant. There's still some resistance though.
ChatGPT has been like WebMD on steroids. It's been amazing to see like some of the differences. And I believe obviously as AI continues to improve, it's going to, for better or for worse, it's going to significantly advance things, advance our access to information. It might make us dependent a little much on the information. I'm concerned about that, but other than that, I mean, I use it a lot. I don't take it as Bible, but I use it, and I definitely am pretty astonished and amazed at kind of the trajectory that's headed in. But I wanted, because we talked a lot about the toxins, right? That can obviously influence perimenopause. We dialed a little bit into obviously the hormone aspect of this. What about exercise? Like, are there exercises that you can do that are more beneficial to do when you're going through perimenopause?
Yes, absolutely. And this might be surprising for people, especially when I grew up, everything was focused on cardio. And now we know weightlifting is actually going to be most beneficial really across all ages. We know that muscle is so important for insulin sensitivity. It's such a good muscle for longevity in general. As we age, the more muscle mass, the stronger we are, the less likely we're going to break a hip or a bone or something like that. So for women in perimenopause and even before, weightlifting needs to be definitely part of your exercise routine. And this is where I teach a little bit of the cycle syncing with regards to working out. So that first 2 weeks, the follicular phase, that's when your estradiol is higher. Now, this is when you can do HIIT workouts, so high intensity interval training and sprints. So this would be the best time to do that. So when I run my sprint intervals, because I want to make sure my VO2 max is good as I'm aging, that I have a good aerobic activity. So you want to do it those first 2 weeks. And then this is when you're going to be lifting weights throughout your cycle, but this is going to be lower reps and higher weights. So this is when you're really going to push it. And why? Why during the follicular phase? Well, they've actually done studies that show women are more likely to get injured during the luteal phase. And that's that second half of the cycle. Yeah, it's really interesting. They followed some professional soccer players in Europe, and they looked at over 700 menstrual cycles of these women. And there was more injury in that second half of the cycle, that luteal phase. So I tell patients during that second half of the luteal phase, that is when still lift weights, because we want to keep lifting weights because that is going to help with insulin sensitivity. It's going to help with our body composition, which is really important as we age. But you're going to do more reps and lower weights. So you're not going to roll in there and try to like do a personal, record, not during the luteal phase. And you're also not going to Orange Theory in your luteal phase, and you're not doing sprints. Okay. because you are more likely, with looking at data, you're more likely to get injured. So another good thing to do is do mobility workouts during that second half, walk at an incline, all of that. So that is where we want to tailor our workouts based on our menstrual cycle too. And it was really interesting. I had a patient that she tore her ACL playing soccer, like a pretty competitive soccer. And I'm like, you were in your luteal phase, weren't you? And she's like, yeah. I'm like, you can't avoid doing things like a soccer game, during your luteal phase, but be more mindful, especially when it comes to training. So it's really cool to see they're doing more data, more studies on women's menstrual cycle, because before, with research, women, like I said, we're different every day. So men are a better test subject because they're not changing every day, just whatever you're studying is. Yeah. So it's been very interesting to see the research turn a little bit.
No, I think it's really cool. And like I said, I've seen firsthand, I've seen it empower my wife to, make better decisions for her body. And, just to see that come to life is just pretty cool to see, because it's really unheard of. I've never heard of that stuff before. Even growing up, I know my mom never, did anything different, and so it's just really cool to see advancements in medicine and technology be able to help people, fulfill themselves and live healthier, happier lives, which is really cool to see. How about food? Is there something, any way we can change the way we eat to support ourselves during perimenopause?
Yes. So protein is key here, lots of protein and healthy fats. And really healthy fats should be on everyone's priority list because cholesterol is the top of our hormone cascade. Every other hormone, cortisol, pregnenolone, DHEA, testosterone, progesterone, everything comes from cholesterol. So when I grew up and, I was born in 82 and low fat. So when I was in high school, low fat craze was the thing, everyone was into low fat. So now it's flipping that switch and like loving fat and eating a lot of fat. So for your menstrual cycle, the other thing that has really been trendy, right, is fasting. And I love fasting, but I love it when fasting is done at the right time. So for women, follicular phase is when you would want to fast. Follicular phase is when estradiol is higher and you're more insulin sensitive, but also it's a better time to fast. Okay. You're not going to be as stressed out as fasting. So when we go to the luteal phase, if you fast there, this is where progesterone should be dominant. If you're stressing out your body, like with cortisol, progesterone is going to go to cortisol. Your cortisol is going to rise. It's stressful, and that's going to steal that progesterone. So I see women failing when they are doing a lot of fasting during that luteal phase, and they're also, they're shortening their cycles, their progesterone's affected, and they're failing at it. So when I tell someone to start like a new diet, I have most of my patients are gluten-free. I tell them to start it in their follicular phase because they're going to more likely stick to it. They're not going to be as emotional. They're not going to be as stressed. And then also fasting. So I will only do my long fast, like a 24-hour fast once a month. I usually do minimum. I will do that in my follicular phase. And then in the luteal phase, you have to listen to your body, right? If you still want to do some intermittent fasting and it's not stressing your body out, you can still do that. But long fasts, I wouldn't. And I also have women wear a continuous glucose monitor their entire cycle to see, because some women can't do intermittent fasting at all. They get a massive blood sugar spike, which is indicating stress on the body. So I've had that show up a few times with patients where they were just not good at intermittent fasting. It was like every day was a stress signal. So instead, I would just have them do like 124, 36-hour fast a month. So focus on protein and fats. And then during the luteal phase, that is where you do want to add in some more complex carbohydrates. Now, if someone is doing more keto or they're more keto adapted, then I would say just increase your fats. because we do want a little bit more calories during that second half of the cycle. So our body is preparing, if an egg is fertilized, it's preparing to nurture that new baby, right? So we tend to want to eat more. Food is more comfort, it's more of like a comfort. So I've found out that with balancing those two cycles, we'll have less guilt during that luteal phase if we do indulge in some carbohydrates that our body wants, and I tell my patients, I'm like, if you eat more calories then and more carbohydrates, it's okay, because your follicular phase, you're going to get back on track. You can do a fast, you could do more ketogenic. So it's a lot less mental strain, because I've found that women, we tend to be more emotional when it comes to food as compared to men. So it takes a lot of that emotion out of it too.
No, that's a good point. No, I think that's really important, especially like obviously there are changes that happen to the body. And so being able to support those changes with the right foods sounds like a really smart thing to do. I wanted to ask, the world of supplements, we're into biohacking these days, right? We're trying to hack everything. Are there supplements or peptides that can be used?
Yes, I love peptides and been using them for about a decade. And I think they are a great tool as an adjunct, right? I also think that we can over supplement everything, and I love taking supplements, but I also know that they are not a crutch, that I need to work on my sleep, my nutrition. I need to, meditate, pray, and also make sure I'm getting my movement in, which would be weightlifting. So those 4 things are most important when it comes, before you are going into supplements or peptides. So with peptides, a lot of people are using GLP-1s. GLP-1s are very helpful when it comes to perimenopause. This is when some patients, they just get stuck, right? They are stuck in this insulin resistant state, and they've tried everything. They've tried diet, they've tried nutrition, everything is perfect. And I felt lower doses of a GLP-1 has really helped them just come out of that insulin resistance. And I'll use that in patients for a couple months. And then after those few months, then we'll go back to their normal routine and they'll do well. But what are we working on while they're on a GLP-1? Well, protein, what we spoke about before, protein goals, weightlifting, sleep. So it's not just a peptide in isolation.
Yeah. And I know it's like one of those controversial things. Some people swear by it. Some people, swear against it. And obviously more research needs to be done and all that fun stuff. We don't have a whole lot of data, but it's already been a couple of years. So, it's getting more and more promising that we're seeing. But, I think it's if you need it and there's benefit there, I mean, just like anything else in the world, it's worth a shot,
Yeah. And there's other things with it's not just GLP-1s. There's peptides, growth hormone secretagogues that can help increase muscle mass, and those can be used alongside supplements. So, and there's 5-amino-1-MQ, which is a mitochondrial peptide. There's so many other peptides, ones for gut health and inflammation. So it's awesome. And this is where, we were talking about ChatGPT before. That's good, but it's also good to have a doctor that is used to working with all of these and can look at just where you need the most support, because they are expensive. And I tend to find out that peptides, they work better when you're just functioning well overall and you have the low hanging fruit taken care of.
Is there, you just based upon your experience, is there a patient subset of the population where you wouldn't recommend, peptides to?
Well, specifically GLP-1s or just any peptides?
Sure, yeah.
Yeah. So GLP-1s, that one, anyone that is not going to commit to building muscle mass or preserving muscle mass. I mean, because the last thing you want to do is have them lose lots of weight. And 1, they'll gain it back if they don't build muscle. And 2, if they're skinny fat, right? And the other thing that's really hard is once you lose muscle post age 40, it's harder to get that muscle back, and if they're already not doing that. So I think that's honestly like scary. There's a lot of med spas. There's a lot of companies that you can just buy a GLP-1, but they're not talking about these risks of how scary it would be to lose that muscle mass, that is hard. Also, GLP-1s, there is a black box warning. You just have to make sure that there's no family history of multiple endocrine neoplasias or papillary thyroid cancer. So there's little nuances with it too, but most of the time peptides are very safe.
Yeah, no, thank you for clarifying that. I think it's important. How does faith play a role in perimenopause?
Yes. So faith, I have seen perimenopause women are just under attack. So when we look at spiritual warfare, this is just where it all comes to a head. And think about it. Like, I talked to my husband about this. He's like, oh, so-and-so are getting a divorce. I'm like, I bet you she's in perimenopause. How old is she? There's a lot that goes on, and hormones, it's a lot. When your hormones aren't balanced, there's going to be, more arguments. There's going to be more heartache in the house, and it's a lot of stress with all the other things that women have on their plates. Like I said, kids in travel sports, dealing with aging parents. A lot of women work a full-time job and they come home and manage a full-time household. So it's a lot on women. And I feel like this is where the enemy, the devil, he sits in there like a lion ready to pounce. And that's when he does it. And that's what I've seen. So our faith is very important here, that, we truly rely on God, and we are spending time each day, in prayer and making sure we have a strong foundation to go through all of this, because it's not easy.
Yeah, no, and it's well said, and it's really important. I know, there people of all different religions might be listening in and tuning in, and it's just important to have faith. I think it's no matter which God you pray to or what you believe in. Yeah, I think two things that are really important is we all respect one another's beliefs, and we believe in something. Yeah, I think that makes a huge difference. So I really appreciate, I appreciate your attention on that, because I think that it's unfortunately, a disadvantage of our advancements in society is sometimes we lose sight of that fact, of the spiritualness that brings us together.
Oh yeah. Yeah. It's very important to all love and respect each other. Mm-hmm.
Yeah. So the reason we talk so much about perimenopause today is because you actually noticed that people in perimenopause happen to be the sickest. Can you break that down a little bit for us so we can really understand the importance of this and making sure that we're really grasping this information we talked about today, because it really is important.
Yes. Once again, when hormones are out of balance, it magnifies all the other problems that make it worse. So say you already have a gut imbalance or dysbiosis due to mold exposure or an overgrowth of candida. So add on hormonal imbalance and perimenopause, it's just going to magnify it and make it feel so much worse. And it's a transition too. And whenever we have like a transition in health, we also notice that things could get sicker or get worse. We see that, with kids and puberty, and then women postpartum is a huge hormone shift. We see a lot of autoimmune diseases and things stirred up there. So especially for women, we have really big hormone changes. So this really can bring out sickness. And this is when a lot of women go and they seek health from conventional methods and conventional doctors. And this is where they're tried to put on birth control or something like that. And that's just covering up what's going on. So it's really nice when yes, there's a hormone problem, but what's underneath it. And a lot of times it's gut health, or it's mold or Lyme disease or something like that. So then we can fix it all.
Yeah, no, well said. Well, first off, thank you so much for taking the time to be with us here today. Where can everyone find you? How do they work with you? Tell us everything.
Yeah, absolutely. I am most active probably on Instagram, Integrative Dr. Mom, Integrative DRMOM. I have a YouTube and I also have a podcast, which you have an awesome episode on there.
Yes.
And then I'm coming out with a book, The Perimenopause Reset, and that will be here soon at the end of July.
That's awesome. Yeah. And that'll be available everywhere, Amazon, Barnes & Noble, you name it.
Yes. If they go to drjenbook.com, they can grab it there and find out more information.
Well, thank you again for taking the time to be here with us today. We really appreciate it. I know I learned a lot. I hope you did as well. And any last parting words before we go?
No, thank you so much. And I hope everyone listening out there, this information can help them or a loved one.
Yes, if this resonated with you, if you learned something, please like, share, comment, get the word out. Thanks so much for listening to another episode of Never Been Sicker.